Welcome, everyone. This is a pre-nursing exam vocabulary review. Please be sure to like, comment, and subscribe to our channel. And share this video with a student who you know may be taking a pre-nursing exam soon. Let's get started. Abrupt definition. Sudden, unexpected, often catching those around off guard. Brief to the point of rudeness. Curt. Example: the patient experienced an abrupt drop in blood pressure, prompting the nurse to alert the physician immediately. Abstain definition: to intentionally refrain from doing something, particularly actions deemed unhealthy or ethically questionable. It involves opting out of participation. Example: nursing students learn to abstain from making assumptions until they have conducted a complete patient assessment. Access definition: the ability, right, or means to approach, enter, utilize, or retrieve something. Example: nurses must ensure they have proper access to the patient's medical records before beginning care. Accountable definition: required or expected to justify actions or decisions. Responsible: taking ownership of one's actions and their consequences, whether positive or negative. Example: nurses are accountable for accurately documenting patient care in the chart. Acute definition: characterized by sudden onset and short duration, often severe. Acute conditions can be critical and require immediate attention to prevent further complications. Example: the nurse responded quickly to the patient's acute chest pain symptoms. Adhere definition: to stick firmly to a surface or comply with a rule. Example: nursing students must adhere to the hospital's hygiene protocols during clinical rotations. Adverse definition: harmful or unfavorable. Example: the nurse monitored the patient closely for any adverse reactions to the new medication. Aegis definition: protection, backing, or support. Example: under the aegis of their clinical instructor, the nursing students performed their first wound dressing change. Affect definition: to influence or make a difference to. Example: the nurse explained how stress can affect a patient's recovery time. Aggregate definition: an entity created by merging various elements. Example: the aggregate data from patient surveys helped improve hospital policies. Aid definition: to provide help or assistance. Example: the nurse used a walker to aid the patient in ambulation after surgery. Aid definition: a person who assists a professional, such as a nurse's aide. Example: the nurse's aide helped monitor vital signs during the morning rounds. Allergy definition: an immune system reaction triggered by a foreign substance. Example: the nurse ensured that the patient's latex allergy was documented clearly. Ambivalent definition: having mixed or contradictory feelings about something. Example: the patient was ambivalent about starting chemotherapy due to possible side effects. Amount definition: the quantity of something. Example: the nurse measured the amount of fluid in the drainage bag every hour. Anaphylaxis definition: a serious life-threatening allergic response. Example: the nurse promptly administered epinephrine as soon as the patient exhibited symptoms of anaphylaxis. Anatomy definition: the study of the structure of living organisms. Example: understanding anatomy is essential for correctly placing an IV. Annual definition: occurring once every year. Example: nurses must complete annual CPR certification to stay compliant. Applicable definition: relevant or appropriate to a particular matter or situation. Example: the infection control procedures are applicable to all departments in the hospital. Assessment definition: the process of assessing or estimating the nature, quality, or capabilities of an individual or object. Example: the nursing assessment included vital signs, mental status, and skin condition. Assiduous definition, showing great care and perseverance. Example: the nursing student was assiduous in practicing sterile technique during skills lab. Asepsis. Definition: the absence of bacteria, viruses, and other microorganisms. Example: maintaining asepsis during catheter insertion is critical to preventing infection. Audible. Definition: capable of being heard. Example: the nurse noted audible wheezing during the patient's lung assessment. Benevolent. Definition: kind and well-meaning. Example: her benevolent approach helped calm the anxious patient before surgery. Bilateral. Definition: involving both sides. Example: the patient reported bilateral leg pain, requiring further evaluation by the nurse. Boisterous. Definition: noisy and energetic. Example: the pediatric unit was filled with the boisterous laughter of children. Brazen. Definition: bold and without shame, daring and unapologetic. Example: the student made a brazen mistake but used it as a learning opportunity in clinicals. Brusque. Definition: abrupt or blunt in manner or speech, often to the point of rudeness. Example sentence: the patient was upset by the doctor's brusque response when asking about their condition. Capacious. Definition: roomy or spacious. Example: the nurse's capacious tote held her stethoscope, manual, and other essentials. Cardiac. Definition: relating to the heart. Example: the cardiac monitor showed irregular rhythms, alerting the nurse to act quickly. Cast. Definition: a protective shell molded to protect broken or injured bones. Example: the nurse checked for circulation and skin integrity under the patient's leg. Cast. Cavity. Definition: a hollow space within the body or a tooth. Example: during assessment, the nurse explained that abdominal cavities hold several organs. Cease. Definition: to stop or bring to an end. Example: the nurse instructed the patient to cease taking the medication due to side effects. Changing. Definition: becoming different, altering. Example: nurses must adapt to the changing needs of patients during shift transitions. Chronic. Definition: persisting for a long time or constantly recurring. Example: the nurse educated the patient on managing chronic back pain through physical therapy. Chronology. Definition: the arrangement of events or dates in the order of their occurrence. Example: accurate documentation helps maintain the chronology of a patient's symptoms. Circuit. Definition: a path for electrical flow or a repeated route. Example: the defibrillator relies on a closed circuit to deliver an electric shock. Circuitous. Definition: longer than the most direct way. Indirect. Example: the student nurse took a circuitous route to the patient's room and got lost in the process. Collateral. Definition: located next to each other, serving as a secondary or accompanying element. Example: the nurse monitored the patient for collateral circulation after a cast application. Complication. Definition: a secondary disease or condition that develops during the course of a primary disease. Example: infection is a common complication following surgical procedures. Comply. Definition: to act in accordance with a rule or command. Example: the nurse ensured that patients comply with medication instructions to avoid relapse. Concave. Definition: a surface that curves outward. Example: the nurse noticed the patient's concave abdomen during the abdominal assessment. Concise. Definition: brief but comprehensive. Example: Nursing reports must be concise to ensure quick understanding during shift change. Consistency, definition, the quality of always behaving or performing in a similar way. Example, the consistency of stool can help nurses determine gastrointestinal issues. Constrict, definition, to make narrower, especially by encircling pressure. Example, cold temperatures can constrict blood vessels, increasing blood pressure. Contingent, definition, dependent on specific conditions. Example, the patient's discharge was contingent on stable vital signs. Contraindication, definition, a specific situation where a drug, procedure, or surgery should not be used. Example, allergy to penicillin is a contraindication for its use. Contour, definition, the outline or shape of something. Example, the nurse observed the contour of the wound to monitor healing. Contract, definition, to shorten or tighten, or a formal agreement. Example, the muscle may contract involuntarily during a seizure. Convulsion, definition, a sudden, violent, irregular movement of the body due to muscle contractions. Seizures, example, the nurse documented the duration of the patient's convulsion during seizure monitoring. Copious, definition, abundant in supply or quantity, large in amount. Example, the patient was losing copious amounts of blood following the surgery, requiring immediate intervention. Cursory definition, hasty and therefore not thorough or detailed. Example, the nurse gave the patient's chart a cursory glance and missed a critical medication allergy. Deficit, definition, a deficiency or lack of something. Example, the nurse noted a fluid volume deficit due to excessive vomiting. Deleterious, definition, causing harm or damage. Example, smoking has deleterious effects on wound healing, which the nurse explained clearly to the patient. Depress, definition, to lower in spirits or to physically push down. Example, the student gently depressed the stethoscope head against the patient's chest during assessment. Depth, definition, the distance downward or inward. Example, the nurse documented the depth of the wound to monitor healing progress. Deter, definition, to discourage or prevent someone from taking action, often by instilling fear or doubt. Example, proper use of personal protective equipment can deter the spread of infectious diseases among healthcare workers. Deteriorating, definition, becoming progressively worse. Example, the patient's deteriorating condition prompted an immediate reassessment. Device, definition, a tool or piece of equipment designed for a specific purpose. Example, the nurse calibrated the monitoring device to ensure accurate vital sign readings. Diagnosis, definition, the identification of a disease or condition through assessment. Example, the nursing student practiced writing a care plan based on a hypothetical diagnosis. Digression, definition, a temporary departure from the main topic. Example, during the health teaching session, the nurse avoided digression to stay focused. Dilate, definition, to broaden or enlarge. Example, the nurse assessed the patient's pupils to see if they dilate in response to light. Dilute, definition, to make a liquid thinner or weaker by adding another substance. Example, the medication was diluted before administration to avoid irritation. Discrete, definition, separate and distinct. Example, the nurse documented discrete lesions on different areas of the skin. Disdain, definition, a feeling of contempt or scorn. Example, a professional nurse should never express disdain toward any patient's condition. Distal, definition, farther from the center of the body or point of attachment. Example: the nurse palpated the distal pulse to check circulation in the foot. Distended definition: enlarged or swollen from internal pressure. Example: the nurse noted the patient's abdomen was distended and reported it to the provider. Docile definition: easily managed or handled. Example: the pediatric patient was surprisingly docile during the vaccination. Dosage definition: the amount and frequency of a medication. Example: the nurse double-checked the dosage before administering the drug to avoid error. Dysfunction definition: impaired or abnormal functioning. Example: renal dysfunction requires immediate intervention from healthcare staff. Edema definition: swelling caused by excess fluid in body tissues. Example: the nurse assessed for pitting edema in the patient's lower extremities. Electrolytes definition: minerals that help maintain fluid balance and nerve muscle function. Example: after vomiting, the patient received IV fluids to restore lost electrolytes. Elevate definition: to raise or lift something up. Example: the nurse instructed the patient to elevate their leg to reduce swelling. Empathy definition: the ability to understand and share the feelings of another. Example: empathy is essential for nurses to build trust with their patients. Ephemeral definition: lasting for a very short time. Example: the patient experienced only ephemeral relief after the initial pain medication. Equilibrium definition: a state of balance. Example: maintaining fluid and electrolyte equilibrium is essential in critically ill patients. Eradicate definition: to completely eliminate or destroy. Example: the nurse educated the patient on how to help eradicate the infection with proper hygiene. Etiology definition: the cause or origin of a disease or condition. Example: understanding the etiology of hypertension helps nurses provide appropriate interventions. Evaluation definition: the process of assessing or appraising a condition or situation. Example: nurses perform an evaluation to determine whether treatment goals have been met. Excess definition: an amount that is more than necessary. Example: excess fluid in the lungs may indicate heart failure, which nurses monitor closely. Exogenous definition: originating from outside the body. Example: exogenous bacteria introduced during surgery can lead to infection. Expand definition: to increase in size, volume, or scope. Example: the lungs expand as the patient inhales deeply during a respiratory exam. Expectorate definition: to cough up or spit out mucus or phlegm from the throat or lungs. Example: the patient was instructed to expectorate sputum into a sterile container for testing. Exposure definition: contact with something harmful or the act of being exposed. Example: nurses must minimize exposure to infectious agents in the hospital setting. External definition: located outside the body. Example: the nurse applied an external dressing to the surgical wound. Fatal definition: causing death. Example: sepsis can be fatal if not treated promptly by the healthcare team. Fatigued definition: extreme tiredness or exhaustion. Example: the nursing student experienced fatigue after a long clinical shift. Flaccid definition: lacking firmness or muscle tone. Example: the patient's arm became flaccid following a stroke, requiring physical therapy. Fluid balance definition: the balance between fluid intake and output in the body. Example: nurses monitor fluid balance to prevent dehydration or fluid overload. Flushed definition: reddened or warmed, often from emotion or fever. Example: the patient appeared flushed and febrile during the assessment. Fortuitous definition: happening by chance, often beneficially. Example, it was fortuitous that the nurse caught the early signs of a stroke. Gaping definition, wide open, often describing a wound. Example, the nurse covered the gaping wound with sterile gauze to prevent infection. Gastrointestinal definition, related to the stomach and intestines. Example, the patient reported gastrointestinal discomfort after the meal. Gender definition, the state of being male, female, or other identity. Example, the nurse explained how gender can influence heart disease symptoms. Hematologic definition, related to blood or the study of blood. Example, the nurse reviewed the patient's hematologic results for signs of anemia. Hemorrhage definition, excessive or uncontrolled bleeding. Example, nurses must monitor postoperative patients for signs of internal hemorrhage. Homeostasis definition, the body's ability to maintain a stable internal environment. Example, nurses play a vital role in helping patients maintain homeostasis during illness. Hydration definition, the process of providing or maintaining adequate fluid in the body. Example, the nurse emphasized the importance of proper hydration to the elderly patient. Hygiene definition, conditions or practices conducive to health and cleanliness. Example, nurses teach patients about personal hygiene to prevent infection. Hyperbole definition, exaggerated statements not meant to be taken literally. Example, the instructor warned students not to use hyperbole when documenting symptoms. Hypothesis definition, a proposed explanation for a phenomenon, used as a starting point for further investigation. Example, the nursing student formed a hypothesis that the patient's dizziness was due to low blood pressure. Hypoxia definition, a deficiency in the amount of oxygen reaching tissues. Example, the nurse applied oxygen therapy to treat the patient's hypoxia. Imminent definition, about to happen, likely to occur very soon. Example, the nurse prepared the emergency cart, sensing that the patient's cardiac arrest was imminent. Impaired definition, weakened or damaged. Example, the patient had impaired mobility due to a recent hip fracture. Impending definition, about to happen, imminent. Example, the nurse assessed the patient for signs of impending respiratory failure. Impervious definition, not affected or influenced by something, impenetrable. Example, the dressing must be impervious to fluids to prevent infection. Implement definition, to put a plan or action into effect. Example, the nurse implemented a care plan tailored to the patient's needs. Imply definition, to suggest indirectly. Example, the patient's tone seemed to imply dissatisfaction with the treatment. Incidence definition, the rate or frequency of a disease, condition, or event. Example, nurses collect data to track the incidence of hospital-acquired infections. Infection definition, invasion and multiplication of harmful microorganisms in the body. Example, the nurse monitored the surgical site for signs of infection. Infection control definition, practices used to prevent the spread of disease in healthcare settings. Example, hand hygiene is a fundamental part of infection control. Infer definition, to draw a conclusion based on evidence. Example, from the patient's rapid pulse, the nurse could infer that the pain was severe. Inflamed definition, red, swollen, and often painful due to infection or injury. Example, the nurse noted that the surgical incision appeared inflamed. Inflammation definition, a localized physical condition characterized by redness, swelling, and pain. Example, nurses treat inflammation with rest, ice, compression, and elevation rice. Ingest definition, to take in food or substances through the mouth. Example, The patient was unable to ingest solid food due to severe nausea. Initiate, definition, to begin or start something. Example: the nurse will initiate CPR if the patient's breathing stops. Innocuous definition, not harmful or offensive. Example: the nurse reassured the patient that the procedure was innocuous. Insidious definition, proceeding in a gradual, subtle way, but with harmful effects. Example: nurses are trained to detect the insidious onset of sepsis. Intact definition, remaining whole or unharmed. Example: the nurse ensured the dressing remained intact over the surgical wound. Internal definition, inside the body or an organ. Example: internal bleeding is a medical emergency that nurses must identify quickly. Intervention definition, action taken to improve a medical disorder or prevent deterioration, to interfere or modify in a way that provides assistance. Example: the nursing intervention helped stabilize the patient's blood pressure. Invasive definition, involving entry into the body, often through a cut or puncture. Example: invasive procedures require strict sterile technique to prevent infection. Ischemia definition, inadequate blood supply to an organ or part of the body. Example: the nurse monitored for signs of ischemia in the patient's lower limbs. Kinetic definition, related to motion or movement. Example: kinetic energy is considered when helping patients with mobility exercises. Label definition, unstable or easily altered. Example: the patient's label blood pressure required frequent monitoring. Laceration definition, a deep cut or tear in skin or flesh. Example: the nurse cleaned and dressed the laceration to prevent infection. Languid definition, lacking energy or vitality. Example: the nurse noticed the patient appeared unusually languid and fatigued. Latent definition, present but not visible or active. Example: tuberculosis can remain latent for years without symptoms. Lethargic definition, sluggish and lacking energy. Example: a lethargic patient may be showing early signs of illness. Manifestation definition, a sign or symptom of a condition. Example: fever is a common manifestation of infection. Metabolism definition, the chemical processes within the body that maintain life. Example: certain medications can alter a patient's metabolism. Milieu definition, environment or setting, especially a therapeutic one. Example: nurses create a supportive milieu for patients in psychiatric care. Morbidity definition, the condition of being diseased or the incidence of illness in a population. Example: the nurse explained that obesity increases the risk of morbidity, such as heart disease and diabetes. Mortality definition, the state of being subject to death. The death rate in a population. Example: the ICU staff reviewed strategies to reduce patient mortality after noticing an increase in infection-related deaths. Musculoskeletal definition, pertaining to muscles and the skeleton. Example: the nurse assessed the patient's musculoskeletal system for injury. Neurologic definition, relating to the nervous system. Example: a neurologic assessment was conducted after the patient's head injury. Neurovascular definition, relating to nerves and blood vessels. Example: neurovascular checks are important after orthopedic surgery. Novice definition, a beginner or someone new to a field. Example: as a novice nurse, she appreciated the guidance from her preceptor. Nutrient definition, a substance that provides nourishment essential for growth and maintenance of life. Example: nurses educate patients about proper nutrient intake to support recovery. Occluded definition, blocked or obstructed. Example: the IV line was not functioning due to an occluded catheter. Ominous definition, giving the impression that something bad or unpleasant is going to happen. Example: the nurse noted the patient's ominous drop in blood pressure. Ongoing definition, continuing, still in progress. Example, the nurse participated in ongoing training for advanced cardiac care. Oral definition, related to the mouth or spoken communication. Example, the patient was instructed to take the medication via the oral route. Otic definition, pertaining to the ear. Example, the doctor prescribed otic drops for the patient's ear infection, and the nurse administered them. Overt definition, done or shown openly, plainly apparent. Example, overt signs of infection include redness, swelling, and warmth. Parameter definition, a measurable factor that defines a system or sets conditions. Example, nurses monitor vital signs as parameters of patient stability. Paroxysmal definition, sudden recurrence or intensification of symptoms. Example, the patient experienced paroxysmal episodes of coughing during the night. Patent definition, open and unobstructed. Example, the nurse ensured the IV line was patent before starting the infusion. Pathogenic definition, capable of causing disease. Example, nurses wear gloves to prevent contact with pathogenic organisms. Pathophysiology definition, the study of how disease processes affect the function of the body. Example, understanding pathophysiology helps nurses explain symptoms to patients. Pharmacology definition, the study of drugs and their effects on the body. Example, nursing students study pharmacology to safely administer medications. Posterior definition, situated behind or at the rear of something. Example, the nurse examined the posterior side of the patient for pressure ulcers. Potent definition, having great power, influence, or effect. Example, morphine is a potent analgesic used for severe pain in patients. Potential definition, capable of becoming real, possible. Example, nurses assess for potential complications after surgery. Pragmatic definition, dealing with problems realistically and practically. Example, nurses often take a pragmatic approach to problem solving on the unit. Precaution definition, a measure taken to prevent harm or trouble. Example, standard precautions are used to prevent the spread of infection. Precipitous definition, very sudden or rapid. Example, the patient experienced a precipitous drop in blood pressure. Precocious definition, showing advanced development at an early age. Example, the pediatric nurse noted the child's precocious language skills. Predisposed definition, to make someone more likely to develop a particular condition or behavior. Example, smoking can predispose patients to respiratory diseases, which nurses must monitor. Pre-existing definition, already present before something else occurred. Example, nurses must review all pre-existing conditions before administering new medications. Primary definition, first in importance. Main example, the nurse's primary concern was maintaining the patient's airway. Priority definition, something considered more important than others. Example, in emergency care, patient safety is always the top priority for nurses. Prognosis definition, the likely course or outcome of a disease. Example, the nurse explained the prognosis after the patient's surgery. Proliferation definition, a rapid increase in number or amount. Example, nurses are concerned about the proliferation of antibiotic-resistant bacteria. Prudent definition, acting with care and thought for the future. Example, it is prudent for nurses to double-check medication dosages. Rampant definition, spreading unchecked or uncontrolled. Example, the nurse reported that infections were rampant in the overcrowded facility. Rationale definition, the reasoning or explanation for an action or belief. Example, nursing students must always understand the rationale behind each intervention. Recur definition, to happen again or repeatedly. Example, the nurse monitored the patient for signs that the symptoms might recur. Regimen, definition. A prescribed course of medical treatment or lifestyle routine. Example, the nurse ensured the patient adhered to the postoperative care regimen. Remission, definition. A period during which symptoms of a disease are reduced or disappear. Example, the oncology nurse celebrated the patient's cancer entering remission. Renal, definition, relating to the kidneys. Example, the nurse monitored the patient for signs of renal dysfunction. Respiration, definition, the process of breathing. Example, nurses count respiration rate as part of vital signs assessment. Restrict, definition, to limit or control. Example, the doctor ordered the nurse to restrict the patient's fluid intake. Retain, definition, to keep or hold on to. Example, patients with kidney issues may retain fluids, which nurses must monitor. Sagacity, definition, wisdom or good judgment. Example, the senior nurse was known for her clinical sagacity in complex cases. Sepsis, definition, a life-threatening condition caused by the body's response to infection. Example, nurses are trained to identify early signs of sepsis to save lives. Side effect, definition, an unintended secondary effect of a drug or treatment. Example, nausea is a common side effect of chemotherapy that nurses must manage. Site, definition, a physical location, especially on the body. Example, the nurse assessed the surgical site for signs of infection. Sputum, definition, mucus and other matter brought up from the lungs by coughing. Example, the nurse collected a sputum sample to test for respiratory infection. Status, definition, the current condition or situation of a patient. Example, the nurse updated the doctor on the patient's neurological status. Strict, definition, demanding adherence to rules or protocols. Example, nurses follow strict hygiene practices to prevent hospital-acquired infections. Sublingual, definition, administered under the tongue. Example, nitroglycerin tablets are often given sublingually for chest pain. Superfluous, definition, more than is needed or necessary. Example, nurses avoid superfluous documentation to focus on patient care. Supplement, definition, something added to enhance or complete. Example, the patient received a calcium supplement to strengthen bone health. Supposition, definition, an assumption made without proof. Example, nurses avoid treatment based on supposition and rely on evidence. Suppress, definition, to stop or inhibit something, such as a response or symptom. Example, antitussive medications are used to suppress coughing. Symmetric, definition, having the same shape or size on both sides. Example, nurses assess if limb strength is symmetric during a neurological exam. Symptom, definition, a physical or mental feature indicating a condition or disease. Example, fever is a common symptom of infection that nurses monitor. Syndrome, definition, a group of symptoms that consistently occur together. Example, nurses cared for a child diagnosed with Down syndrome. Tenacious, definition, persistent or determined. Example, the nursing student showed tenacious effort in mastering clinical skills. Terse, definition, brief and direct, sometimes to the point of rudeness. Example, the nurse gave a terse report due to the urgent situation. Therapeutic, definition, related to healing or treatment. Example, nurses use therapeutic communication to build trust with patients. Toxicity, definition, the degree to which a substance can harm humans or animals. Example, the nurse monitored the patient for signs of chemotherapy toxicity. Transdermal, definition, administered through the skin. Example, the nurse applied a transdermal patch to deliver pain medication. Transient, definition, lasting only a short time. Example, the patient experienced transient dizziness after standing up too quickly. Transmission. Definition: the act of passing something from one person or place to another. Example: nurses take precautions to prevent transmission of infectious diseases. Trauma. Definition: a serious physical or emotional injury. Example: emergency nurses are trained to handle both physical and emotional trauma. Triage. Definition: the process of prioritizing patient care based on severity. Example: nurses perform triage to determine which patients needed immediate attention. Trite. Definition: overused and lacking originality. Example: the instructor encouraged students to avoid trite phrases in patient documentation. Ubiquitous. Definition: present or existing everywhere. Example: hand sanitizer stations are ubiquitous in healthcare facilities. Untoward. Definition: unexpected and inappropriate or inconvenient. Example: the nurse monitored for any untoward effects of the new medication. Urinate. Definition: to discharge urine from the body. Example: the patient was unable to urinate after surgery, prompting a nurse evaluation. Valid. Definition: logically sound, legally or factually acceptable. Example: the nurse ensured the patient gave valid consent before the procedure. Vascular. Definition: relating to blood vessels. Example: the nurse checked for vascular integrity after inserting the IV. Venerable. Definition: deserving respect due to age or wisdom. Example: the venerable nurse educator shared decades of clinical experience. Venerate. Definition: to regard with deep respect. Example: students venerate their mentors who guide them through nursing school. Verbal. Definition: expressed in spoken words. Example: the nurse received verbal orders from the physician during the emergency. Virus. Definition: a microscopic infectious agent that replicates inside living cells. Example: nurses follow strict protocols when caring for patients with a contagious virus. Viscosity. Definition: the thickness or resistance to flow in a fluid. Example: the nurse noted the high viscosity of the patient's sputum sample. Vital. Definition: absolutely necessary or essential. Example: monitoring vital organs is crucial in the ICU. Vital signs. Definition: clinical measurements that indicate the state of a patient's essential body functions. They include indicators such as body temperature, pulse rate, respiratory rate, and blood pressure. Example: the nurse recorded the patient's vital signs every 4 hours. Void. Definition: to empty, especially urine from the bladder. Example: the patient was asked to void before surgery. Volume. Definition: the amount of space that a substance occupies. Example: the nurse checked the volume of IV fluid remaining in the bag. Wary. Definition: cautious or alert to danger or problems. Example: the nurse remained wary of drug interactions in elderly patients. Thank you for watching. Don't forget to like, comment, and subscribe. Check out our other videos here. And if you need study guide or a printable version of this video, check the description box down below. Good luck on your exam.